So we talked about the amelioration of negative emotion. We could also talk about the facilitation of positive emotion. Well, one of the things that happens is if you break down the person's goals into these different domains, you can establish micro goals. And what happens is that as people observe themselves moving positively towards the accomplishment of micro goals, their positive emotion systems start to turn back on. And the reason for that is that, well, imagine you make a micro goal, and the goal might be, well, this month I'm going to clean up my room. And so the first thing you do is organize your sock drawer, and which is harder than it sounds, because maybe you got like 30 pairs of socks in there that you've had for 10 years, and some of them are ratty, and a lot of them are stylish, and some of them are uncomfortable, and you have to take them out of the drawer. Then you have to try them all on. Then you have to make the difficult decision about when a pair of socks is a little too ratty to keep, and you have to contend with your obsessive compulsive disorder while you're doing that. That might make you want to hoard. And it's not that easy. But if you see yourself doing it and you make a little progress, then what happens is that your brain marks that progress by producing dopamine. And dopamine is the fundamental chemical that mediates the kind of positive emotion that makes people feel alive and hopeful. And it's the drug, by the way, that is made manifest in excess by drugs like cocaine and heroin and methamphetamine, all the drugs of abuse that people take to get stimulated. They're all dopaminergic. So the dopamine system gives you a little kick, which is, yes, that was good. And then you might think, well, what is that kick? Well, it's a sign that you should do more of that. But then also what the dopamine does neurochemically is that, imagine there was a sequence of neurons that were activated as you were progressing towards the successful implementation of that goal. And what the dopamine does is make those neurons grow, either proliferate more, they develop more connections, or the connections get thicker. And so that means that those things that you did successfully are more likely to become part of you and to manifest themselves in the future. And that's growth. And you feel that positively. And it's literally growth. It's literally biological growth. Think, well, we're moving towards growth. It's like, well, it's either that or stasis or death. And so by setting up these micro goals in relationship to broader goals, then you can activate the positive emotion system, and that's antidepressant. And so I have a program online, by the way, self-authoring program that helps people get their story straight. And getting their story straight would be laying out their past, laying out their present, laying out their future. Figuring out what skills they want to develop, coming up with a strategy for the development of the skills, and laying out a vision of goals. And all of that's antidepressant in the most fundamental sense. And then it's possible, too, that if you are in dire straits and you have a health problem that's associated with depression, that an antidepressant can help with this to get the ball rolling. And as I said, if you have a life, sometimes the antidepressant can be quite effective, although that doesn't necessarily mean it's addressing the underlying cause of the depression, which is often a very difficult thing to specify. But it's better than being paralyzed into inability and suffering terribly, despite the fact that you actually have your life together. And if you don't have your life together, well, then you can do the process of decomposition that I just described and start making incremental movement towards putting each of those domains in order and putting yourself in order in that manner. And that's going to constrain your anxiety and your suffering, and it's going to facilitate positive emotion. So that's a big part of psychotherapy, all of that, on the biochemical front and also on the behavioral and practical front. The cognitive behaviorists would concentrate more on restructuring your conceptual schema. And so, for example, maybe you're talking to someone who's intellectually arrogant but unemployed about the fact that they feel that an entry-level job is beneath them. And so you might investigate that. It's like, well, beneath what exactly? Beneath your intellectual pride? Do you have a better option? Maybe you're conceptualizing the workplace inappropriately in a manner that's counterproductive with regards to your own stated goals. Do you want to be alone and isolated, miserable and unproductive and non-generous? Or do you want to get the ball rolling? Well, I guess I want to get the ball rolling. Well, are you willing to start at the beginning? Well, no, I think I should start at the top. It's like, well, there is a problem in your conceptual scheme because no one's going to put you at the top. And you shouldn't even be there. You don't want to set yourself up for failure. You might as well start somewhere you can start. And so that's cognitive modification in some sense. It's the retooling of the categories that the person is using to interact with the world. And so behavioral therapists concentrate on the acquisition of the actual skills. Cognitive therapists deal with the micro-conceptions that might be counterproductive. You can see some of those in depression. I did a bad thing, therefore I'm a terrible person. It's like, that's a little too simple and needs to be differentiated. It's counterproductive. Now, anxiety is another condition that is commonly addressed in psychotherapy. And the best treatment for anxiety, perhaps the only treatment, is what's come to be known as exposure therapy. And imagine someone is progressing towards a goal. Here's an example. I don't like my job. I work for a tyrant. I need to get a new job. Otherwise, I'm going to be a miserable slave. It's like, okay, but I don't seem to be able to do it. I'm too afraid. Okay, what are you afraid of? Well, my CV is a mess because my educational history is spotty. I can't tolerate rejection, and I know if I send out my CV that I'm going to get like 50 rejections for every possible interview I might get. And that's a lot of rejection, man, and I don't know if I can handle that. And I'm not very good in interviews. It's like, okay, you got 3 things there to be afraid of. Those are real fears, and they're real things to be afraid of. It's not just neurosis, although some of it might be if it's exaggerated. So you can start walking through the person's specific fears about each of those situations, and you can find out, maybe they'll tell you about a time they went to an interview and they're being interviewed by a psychopathic narcissist, and the person just took the opportunity to level them. And so now they've been afraid about an interview ever since then. And so you can walk that through and you can analyze it. You can help the person decide what other strategies they might have utilized, or you can help them identify when an interview is just counterproductive. Like if you go to a job interview and you're being decent and you're not embarrassing yourself, and the person who's interviewing you is just a prick, it's like, well, do you want to work there? And the answer is no. And one of the things to realize that when you're in an interview situation, especially if you've set yourself up reasonably, it's a two-way interview, man. It's like, do they want you? That's maybe the big question. But at least 20% of the question is, do you think you could work there in a manner that would enable you to be productive and generous? Are these people you want to be around? Now, you may be in a situation where you're in such dire necessity that you have to take whatever the hell's offered you, but you want to think twice about even doing that, because if you're working for someone who just cannot be pleased no matter what you do because all they want to do is make some hell around them, then working there isn't going to work out for you, probably even in the short term. And so it's kind of useful to know that, well, you're also evaluating them. And I don't mean in a high-handed and prideful and arrogant way. I mean, is this a place where you could, in principle, put your best foot forward, at least for some time? And partly what you're doing in the interview is finding that out. Then with the person, you might have them practice the interview. So you have them literally walk in. It's like, okay, I'm the person interviewing you. You're the applicant. Come in. You might give them a stack of papers and tell them that's their CV, or you might have them use their real CV if they've got that organized. Come in, introduce yourself. Back to how to introduce yourself. Say, well, I'm here because I'm interested in this position. And then you can walk the person through the typical interview questions. Why do you want this position? What made you interested in it? What credentials do you have for this? And maybe you don't have any. All you can say is, look, I don't have any particular training for this position, but here's what I can offer. I will show up to work 15 minutes early every day, and I will do my damnedest to learn what I need to learn, and you can rely on me. And so even though I don't know, I could learn. And if you're willing to teach me, I'm willing to learn. And maybe that's not a good enough story, man, but you're not going to make a fool of yourself with that story. And sometimes you're going to be talking to someone who needs someone. And maybe if you can convince them that, you're kind of useless, but you're capable of learning, that'll be good enough. And so you keep practicing that with people, varying the interview situation. And that's exposure. They're afraid of the situation, right? And so you get them to confront it voluntarily and to develop the requisite skills until they're comfortable with it and they get some confidence in doing it. And then maybe you have to do the same thing with their CV. It's like, well, I don't want to send my CV out, my resume, because I'm embarrassed about it. It's like, well, why don't you print it out and bring it to me and we'll go through it. Well, then the person doesn't. Like maybe they don't even come to therapy the next session because there's no way they're doing that. And then they come in 2 weeks and they're all embarrassed. They say, I couldn't even open the folder on my computer that had my CV in it. It's like, fair enough, man. What are you afraid of? Well, my educational history is spotty and I didn't do very well in college and I have a pretty bad job record because I have jobs I quit because I was, not putting myself together very well. And there's sporadic spaces in there. And it's like, okay, fine. It's like this week, your task is just to open the folder and look at your CV. That's all you have to do. And maybe they come back next week and say, oh, I did that. I said, well, what do you see? Well, it's not as bad as I thought it was. Well, that's often what people find if they actually confront the thing they're afraid of. It's like, it's bad, man, but it's not as bad as they thought, and they could actually do it. And then maybe the next week they can bring their CV, and then you start going through it with a bit of a critical eye. It's like, well, you have to address this, and maybe you should be taking some online courses. So when someone talks about your spotty educational history, you can say, yeah, I understand that, but here's the steps I've already put in place to redress that. And maybe you have to do some volunteer work for a while. You got to get your CV in enough order so that you can talk about it without embarrassing yourself into, a fit of useless stupidity. And that's going to require some practice too. And maybe as a therapist, you challenge the person about the content of their CV a bit until you help them develop an accounting for themselves. And then you've eliminated the interview fear and you've eliminated the fear of the past, right? That's the CV or resume fear. And that's exposure therapy. And what the exposure therapy fundamentally is the use of voluntary confrontation with challenges that would otherwise paralyze. And there's a good rule of thumb, which is something like pick the largest snake that the person is capable of dealing with. So I'll give you an example. Maybe you have a woman in your therapy practice who has an anxiety disorder, agoraphobia. And because of that, she can barely go out of her house now. And maybe she can make it to psychotherapy. Maybe you have to do it virtually because she can't go out of her house. And but we'll assume she can at least get to the therapy session. But she won't take the elevator. She goes up the stairs. Say, well, I'm afraid of an elevator. It's like, why? Well, what if I got trapped in an elevator? What if the power went off? What if I got trapped in there? It's like, okay, well, what if you did? Well, I don't feel my heart's reliable. Sometimes people with agoraphobia have panic attacks. And when they have panic attacks, their heart rate goes up extremely high. And for quite a protracted period, sometimes that can be a neurological disorder, a biochemical disorder. And then when their heart rate goes up, they think, oh my God, I'm going to die. And lots of times people who are agoraphobic have been to the emergency ward several times to have their heart checked out because they think they're going to die. But they don't just think they're going to die, because that's not bad enough. They think they're going to die in a very noisy way, very publicly, and make a fool of themselves and a spectacle while they're dying. And so the fear is twofold: fear of mortality and fear of public humiliation. And so that's the core of agoraphobia. And then every situation where those fears might emerge, the person starts to avoid, and then the fear gets bigger and bigger because of the avoidance, because they're making themselves smaller and smaller in comparison by avoiding. And then they start to become afraid of everything. And then they end up at home. And the only reason they can be at home is because you can't run away from home. That's where you're trapped. And maybe they're afraid of elevators. Why? Well, what if you get trapped in an elevator and then you have a panic attack, then your heart rate accelerates, and then you might die and you can't get to a hospital. And then maybe there's someone in the elevator with you, and while you're panicking and maybe dying, you're making a fool of yourself. And there's going to be a fantasy like that at the back of the pathology that usually involves something like fear of mortality and fear of public humiliation combined, because those are the two big fears. That's why people are afraid of public speaking, right? It's like they're more afraid of public speaking if you do polls than of death. Now, are people really more afraid of public speaking? Well, perhaps not, but typical nightmare is to be naked on a stage. And what does it mean? Is to expose all of your inadequacies to public view. And so people are afraid of that. So now the person's afraid of the elevator. The psychoanalyst would say, well, they're not really afraid of the elevator. They're afraid of death. And so if you just help them confront the elevator, you're not going to confront the underlying fear of death. And the answer to that is, well, yes, you are, because for the agoraphobic, the elevator is a place of death. I had an agoraphobic client who literally said, when the doors of the elevator opened up in front of her, that's a tomb. And so the symbol and the reality were right face to face with one another. And when she confronted the elevator, she was also confronting her fear of death. And in doing so, she was becoming not less afraid, but braver. And so then you say, well, how much exposure can you tolerate? So you ask the person, it's like, could you get in an elevator? Well, no, I can't do that. I haven't been in an elevator for 5 years. Did you pass an elevator on the way to my office? Yes. How far away were you? Well, I kind of gave it a wide berth. Well, how far away were you? 15 feet. So, well, could you get to within 14 feet of the elevator? Well, I don't know. Okay, sit there and imagine, bring this to mind as realistically as you can. Imagine walking by that elevator. Okay, make it real. See if you can feel the emotions. Put yourself there. Use your imagination. Okay, now you're by the elevator. What do? Well, I don't look at it. It's like, okay, now just imagine turning your head 15 feet away and looking at it. It's like, what do you see? Well, I see 3 doors and they're double doors and I see some lights above. It's like, okay, imagine those and just keep walking by. Can you do that? Yeah, I can do that. It's like, okay, now do it again. But this time, imagine that you're only 10 feet away. It's like, okay, I can do that. It's making me nervous, but I can do that. Okay, well, do it 2 or 3 times until you're not nervous anymore. So they do that and say, okay, now just imagine you're walking along now, you're 5 feet from the elevator and you stop in front of the middle elevator and you look at it. What do you see? And they tell you, say, well, can you see the paint on the elevator doors? Yes. Are you close enough to see the chips and so forth in the paint? Yes. And the reflections. Okay. So pay attention to that. It's like, okay, maybe that's good enough for the first session because the person's made some progress, and imaginal exposure like that works. Why? Because it's thinking, and thinking works. And imaginal representation is a form of thinking, and it's a deeply embodied form of thinking. It's a kind of game. That's another way of thinking about it. It's a game of challenge. It's a game of optimized challenge. And the person puts themselves in a position of challenge. And that's an approach position. That's associated with positive emotion. That's associated with opening up the cognitive architecture. And that's associated with learning. And it's associated with transformation, maybe all the way down to the genetic level. There's no difference between exposure therapy and learning. They're the same thing. So the person comes the next time. They say, I was feeling a little better this week. That helped me with my confidence doing that. I've been avoiding elevators for a long time, and turned out that I was less afraid than I thought. It's like, yeah. Okay, so think we could do this. Let's do this in reality today. So did you walk by the elevator? Yeah. So how close were you? Well, I got about 10 feet away. Okay, so let's go out there. We'll get you 13 feet away. I'll mark it out with my shoes. I'll pace 13 feet away. We'll put you in front of the elevator, and you can just look at the floor to begin with. You think you can do that? I'm not going to do anything, the therapist says, that you don't agree with voluntarily. I'm not going to force you. You're going to do this all of your own free choice, which is fundamentally important. It puts the person in the right mindset. Okay, so now you're 13 feet away from the elevator and you're looking at it. So you're looking at the dragon. You're looking at the tomb. You're looking at your own death. You're looking at humiliation. And you're seeing that you can do it voluntarily. And so you're growing in your own eyes. And you're growing in reality as well. And so you say, well, is that enough for today? And the person says, no, I think I could do some more. It's like, okay, step 2 feet closer. And then we'll do the same thing. And then maybe by the end of that session, especially if you do it carefully, you got the person right to the point. You might say, okay, you're right beside the elevator. Why don't you just reach out and put your hand on the elevator? And then look, see that your hand is there. Look around. Use your eyes. Don't avoid. See where you are. See where you are in the hallway. Check every little nook and cranny out. Look at yourself. It's like you got your hand on the elevator. Good enough for this week. And so the person comes back next week and they say, there's some things I wanted to talk about with my husband that I haven't talked about for 10 years. And we started talking about them this week. It's like, that's what happens. The bravery generalized. You say, you ready to go after that elevator again? It's like, yeah, I'm ready. It's like, okay, we'll go start a foot away and then you can put your hand on it. And then what I'll do, if it's okay with you, you can back up 5 feet and I'm going to just call the elevator. And then when the doors open, I'm going to hold the doors open and I'm going to let the buzzer go off too, because that's going to scare you. So I'm going to hold the doors open. I'm going to let the buzzer go off. And all you're going to do is look. And so the person says, do you think you can do that? The person says, yes. So you call the elevator and the elevator comes. People get off. And she's embarrassed because she's standing there and the people are watching. And that's okay, but she doesn't move. And you say, okay, I'm going to stand in the elevator doors here and I'm going to just hold them until they buzz. And so she's watching and she's apprehensive about this. And then when the buzzer goes off, she startles. And that shows that she's on edge because startle reflex is exacerbated when people are on edge. Say, okay, how'd that go? Says, well, it made me nervous, but I can do it. It's like, okay, I'm going to let the elevator go. You just relax. And maybe you've also taught the person to relax, by the way, because that can be helpful. But it's not necessary, but it can be helpful. Help them breathe. Help them remember to breathe. And that's something you can do when you're anxious. Just remember to breathe because you'll tend to hold your breath because then the predators can't see you. And so you want to breathe. Say, I'm going to do that again. Exactly the same thing. I'm going to do that again until you don't startle when the buzzer goes off. It's like, okay. So you do that 3 or 4 times and the person's fine. It's like, yeah, okay, I'm bored with that now, which is what you want. And you think, okay, well, this time I'm going to hold the elevator open. I want you to come in and I just want you to put your head in the elevator and look around and just look. And you don't have to be there any longer than you want, but don't retreat too precipitously. Just do it in a calm manner. So come in and look for count to 2. Look for 2 seconds and then go back to where you were. Think you can do that? It's like, yeah, I'm really nervous about that, but I think I can do it. So they do that. And then maybe you have them do it for 10 seconds. Maybe you have them put their hand in front of inside the elevator. And then maybe that's enough for that session. And next session you say, today, maybe you can just walk in the elevator. I'll hold the door open. You know I'll hold the door open. I'm not going to fool you. There's no tricks here. And there bloody well not be any tricks here. Better not be any tricks here. If you're doing this to yourself, no tricks. You have to play an honest game for this to work because you'll invalidate trust otherwise and the whole thing will fall apart. So you do that for 5 sessions. Maybe you've got the person going down 1 floor in the elevator, right, with you. And then maybe the next session, maybe they can do 5 or 6 floors. And then maybe after that, I could stand 20 feet away from the elevator and the person could walk into the elevator by themselves and walk back out. And then maybe after that, they could go down 1 floor. And that's like, they're making progress like mad at that point. And you think it's trivial. It's just the elevator. It's like, no, it's not. It's death and humiliation and an insufficiency in the face of those things. And you're practicing overcoming it.